8 o'clock on Thursday evening here. Here's the part one of my COVID diaries. I'm going to start sharing here with all of you in social media land, because I think it's really important that patients know what's happening on the front lines of this COVID pandemic and what as physicians we're experiencing, what we're seeing. So that being said, I just finished about, 25 visits over the last half day and a half here. And I had a lot of heartbreaking stories. A lot of it was related to COVID. One of the most heartbreaking stories I saw was that a young mother tested positive for COVID because she was at Thanksgiving dinner with another family member who didn't have enough caring or respect for her or her family, and went there with symptoms and didn't wear a mask. And now the whole family likely has been exposed. So please, please, please wear a mask. Stay 6 feet away from people. Wash your hands. Don't go anywhere. Don't do anything if you need to. And if you have any symptoms at all, do not go out. Please reach out to your physician, your local public health department, and determine if you need to get a COVID test to know what to do next. It's COVID diary day 2. Had another busy day here in clinic, seeing some in-person patients, and then lots of video and telephone calls regarding patients. Lots of COVID exposure, lots of patients with symptoms consistent with COVID, and a couple that came back positive. Most concerning is a young patient of mine with Down syndrome who is not able to wear a mask because of his developmental delay, and he got COVID. So please wear a mask, please stay home, please stay safe. Hey, social media land. It's Saturday. I'm hanging out at home, recharging my batteries a little bit, wearing my sweatshirt. There's been a lot of information about this COVID vaccine, which was just issued an emergency use authorization yesterday by the FDA. All the preliminary data is very, very positive. I'm very optimistic this is going to be a big part of how we get out of this COVID pandemic, but it's not going to be the only thing. Obviously, we need to continue to wear masks. We need to continue to socially distance until we can get enough of the population vaccinated and we develop what's called herd immunity. Hey everybody, I've been really busy the last couple of weeks taking care of patients in the outpatient world with lots of calls and emails and messages regarding COVID, but now I'm going inpatient. I'm going into the hospital for 1 week starting tomorrow to take care of some of our sickest patients. I'm not gonna lie, I'm a little scared. I'm afraid I'm gonna be overwhelmed. I'm afraid that I might get COVID and bring it home to my family. I'm afraid a lot of my patients may not survive, quite frankly. But I'm actually probably more encouraged and inspired to see the way my organization has really come together and really supported one another, supported our patients in really creative and innovative ways as well. And I'm probably most encouraged to see some of my colleagues receive their COVID-19 vaccine yesterday at Los Angeles Medical Center, which was really exciting. So I want y'all to know that even though I'm getting a shot right now, I am smiling bigger than you can ever imagine underneath this mask right now. It doesn't even hurt at all. I'm so excited. Hey everybody, I'm rounding here in the hospital today. It's a really busy day. I have well over half my patients have COVID-19. Some are doing better than others. This is real, guys. Please wear your mask, stay safe. Also, vaccine update. I got my COVID-19 vaccine yesterday, as many of you know, and I feel fine. I got a little redness at the injection site and a little bit of soreness in my shoulder where they did the injection, but other than that, I feel fine. No fevers, no chills. I haven't started growing a third eyeball or anything like that. So we're all in this together, so I strongly encourage you, when you have the opportunity, to get your COVID vaccine. But we have to keep wearing masks. We have to keep staying 6 feet apart. We have to minimize social gatherings for a while now. There's light at the end of the tunnel, but we're not out of this yet. Be safe. Thanks. Hey everybody. It's Saturday. I'm now 48 hours post-COVID vaccination, and the only side effects I've seen so far are feeling a glimmer of hope and the inability to stop talking about the fact that I got my COVID vaccine. So that's the good news. I have no symptoms. My arm feels fine. The bad news is I'm feeling extremely overwhelmed and worried about the next couple months. Behind me, you can see a line of cars in line to get their COVID test. It stretches around the block. I could not get into the parking garage today because there were so many people trying to get COVID tests. I was rounding the hospital, and all I gotta say is you guys need to stay home. You need to wear a mask. You need to please limit your holiday gatherings. The next couple months are going to be very, very dark. Please stay safe. I want to share a story with you, which unfortunately is happening every single day, multiple times a day, all across this nation. I had a healthy 41-year-old male this morning who was admitted for COVID pneumonia. Had been here for about 5 days. I went and saw him. He was very short of breath. Oxygen saturation was very low. We decided we need to intubate him. He agreed. He said hello or goodbye to his daughter over FaceTime. We intubated him. Shortly after that, his heart stopped. We did shocks, we did compression and CPR, ended up getting his heart back. But his oxygen levels were still critically low. He ended up having a pneumothorax and fluid and air in the lung space. And he ended up dying. We spent about 2 or 3 hours. Healthy 41-year-old male died of COVID pneumonia today. Please take this seriously. This is a horrible disease. Hey everybody, feels like I'm headed back into a war zone again today, putting on my battle gear here. Today's my last day on service in the hospital and I'm exhausted. I've sent more patients to the ICU or signed their death certificates this week than I ever have before for any week that I've been on service before. COVID-19 is a horrible disease. Please take it seriously. Hey, social media land. About 30 hours post Pfizer COVID vaccine dose number 2. I have a little bit of headache, feeling kind of fatigued. I don't have a fever. I feel a little bit flushed, but no fever, no body aches. The arms shoulders a little bit sore from where I got the vaccine, but otherwise feel great. Some of my friends, however, have felt pretty significant side effects, kind of just really tired and muscle aches and things like that. But again, it's all sort of temporary. It means the body is building immunity, so this is good. It's building up the army to protect you against COVID. So that's good. Hospital is still a disaster. I just called a family member whose mother died this morning from COVID pneumonia, and she was just in tears. It's heartbreaking. I make this phone call every day. Please stay safe, wear a mask, and get your vaccine when you have the opportunity, because this is our shot.